this down a little bit for us. Doctor, it's a pleasure having you back. In the very first place, this looks a little confusing, especially for those who are not in the medical fraternity. If you could just break it down a little bit for us. What does this change mean for especially remuneration for associate consultants, but also what is this change about? What does it intend to achieve?
Good morning, Mildred. Good morning, our listeners. In 2022, Uganda Medical Association had negotiations. In 2021, we had negotiations with government, specifically with the President of Uganda, concerning increasing remuneration for public servants, specifically health workers, in Uganda. In this meeting, the President gave a directive that all health workers in the country should have a salary increment. Unfortunately, during the processes, when the salaries were being prepared, we have different levels among doctors or the different cadres. We have the entry level, which is a medical officer. Then we have the specialists. The specialists, these are doctors who have done 5 years and then 1 year of internship. Then you go back to medical school to specialize. For 3 years, you become a surgeon, a gynecologist, a pediatrician. Now, those are the specialists. And the nomenclature we had in public service was medical officer, special grade. Now, above that level, we have what we call a consultant. Now, a consultant needs the same qualifications like a specialist. The difference is the working experience, whereby you work for government for 6 years, and then they promote you to a consultant, and then after serving for more 3 years, you become a senior consultant. There was an error which happened when the salaries were being appropriated. Minister of Public Service called for a meeting following the presidential directive to align and check for errors in what they had drafted in the salary increments. Unfortunately, Uganda Medical Association was not represented at the time, but other cadres who had unions at the time were represented in that meeting. So the Minister of Public Service confused the title medical officer with this is the doctor who has a Bachelor of Medicine and Bachelor of Surgery, with the medical officer special grade, the old title for the specialists. And they thought medical officer special grade just has maybe some small experience, maybe just a minor difference, without acknowledging the 3 years of going back to medical school to specialize to become a specialist. So when they were appropriating a salary for a medical officer who is a degree holder and a specialist who has specialized, they only put a difference of only 600,000 shillings, meaning they were paying us more so still as medical officers without considering the specialized care we are providing. So we have been agitating since this error happened in July 2022. We have had a lot of meetings with the Prime Minister, the Minister of Health, and the Head of Public Service. And the Head of Public Service directed the Minister of Public Service to do a job re-evaluation to understand the output on ground of a specialist vis-a-vis the kind of pay which was appropriated. And during those job re-evaluation, Minister of Public Service realized that actually the specialists who had the name of medical officer special grade were underpaid. In a follow-up meeting, we agreed that the salary had to change so that we can get an appropriate salary, but we also requested that the name medical officer special grade should be changed to associate consultant so that we do not have such confusion in future, which could lead to such gross errors like underpayment. We are happy that the Head of Public Service took it on, and we have been having a number of meetings, and this has been effected, the change of the name to associate consultant. And we have had an agreement with the government, especially the Head of Public Service, that in the coming budget, we will put enough money or wage which will be able to give us the appropriate salary, which is at least 8.5 million, according to the job re-evaluation which was made by Ministry of Public Service. So to us as health workers, this is a win. It is a big achievement because at least we have achieved half of what we wanted, and the government is in agreement with us that we need an appropriate pay.
Now, Doctor, that clearly means if these were suggestions that you did actually raise, you do welcome this move. How is it going to change not only the welfare of those who are affected, but also service delivery, for lack of a better word, because this is all aimed at ensuring at least there is a little bit of satisfaction coming in from the different cadres in the medical field?
It is going to it has motivated the specialists, gynecologists, the surgeons who are working on our patients in the public health facilities, and it gives hope that after the government has given us the new title and they have agreed to increase our salary, that hope that we shall get the appropriate pay. It is also another very good motivator that now we can work diligently on our patients and provide the needed specialized care which we are supposed to provide because we have received the title, and we are hopeful that even the appropriate pay will come, and we truly thank government and the head of public service for ensuring that this happen. As Uganda Medical Association, since now this has ended, we know the budget process is on right now. We are going to make the necessary moves or anything we have to do right now to ensure that now we chase, we talk to the policy makers and ensure that a wage is put in a budget so that at least by July next year, this appropriate pay comes during our payments.
Very much.